My name is Dr. Shoaib Safiullah. I'm a urologist at Arizona Urology Specialists. My areas of specialty are men's health, sex medicine, benign urology, essentially quality of life care for patients, and complex stone disease. I became a urologist for somewhat personal reasons in that I had a kidney stone, saw the benefit that urology provides to a patient like myself, where I was in pain, was extremely worried, and a urologist took me to the operating room and treated me, and I was better almost immediately thereafter. I learned from that a urologist is a surgeon, and I always wanted to be a surgeon, and that was what took me there. I completed my medical school training in Chicago, at Chicago Medical School at Rosalind Franklin. Then I did my residency at the University of Missouri in Columbia, Missouri. I actually did a research fellowship at UC, University of California, Irvine, in a program called the LIFT Fellowship, where I learned really, I think, to be an academician, and I bring that with me to really anything I do on a day-to-day basis. My philosophy and my approach to treating my patients really comes down to personalizing their care. So ultimately, I treat my patients as they're my own family, right? So I want to ensure that whatever it is that's bringing them into the office, that they're not just any other patient, they're my patient, somebody that's given me the privilege to take care of them. And ultimately, what that means is ensuring that I'm not just treating them like a physiologic problem, right? Ultimately, it comes down to they're an individual. They have issues that may be outside of just their medical problem that may be contributing to their ailment. An example of that would be erectile dysfunction. Sometimes it's not just the physiology behind it, but also the stressors that may be affecting them outside of their medical issues. Looking at their entire history, understanding the person that's sitting in front of me matters, and that often helps me in tailoring a treatment plan for that individual. I actually had a patient come to me from having been evaluated at another practice, and he actually had difficulty urinating. He was miserable, and he was given a single option in how to manage it. When he came to me, I told him, I'm going to take the approach with you that I do with every one of my patients, and that means I'm going to evaluate you fully. After completing my evaluation, I was able to give him a comprehensive set of options in how to manage it, and I explained to him why I would not be approaching it the way that he was offered initially. And I was able to treat him in a minimally invasive way, and we were done a couple of weeks thereafter, and when I saw him back, actually fairly recently, he was very happy. To me, each individual is just like a friend or a family member, and that's how I practice.